Hello and welcome to Lok Talks. This is Dr. Lokesh Bhatia. Dear friends, many times patients are asking a particular term, spondylosis. And this term they find it mainly on the X-ray reports.
In this video, we will be talking on three important terms which usually we get it on our radiological findings: spondylosis, spondylitis and spondylolisthesis. Let's understand what are the significance and importance of this.
And variably the doctor's response is, theek hai, nothing to worry about it. So patient leaves the doctor's office with very confused mind कि इतना बड़ा सारा ऐसा spondylosis लिखा हुआ है और आप कह रहे हो नहीं ठीक है. So now let's understand what is this spondylosis. Spondylosis is nothing, it is basically a descriptive term, more of a radiologic finding, and it is the reflection of a degenerative process on the radiograph. Now, what is a degenerative process? Like graying of hairs, right? The commonest example what I can tell you about is graying of hairs. As we are aging, our hairs start becoming grey, right? Scientifically speaking, more of whatever are the moving parts of the body, spine is one of them. It develops osteoarthritis, means the cartilage starts getting worn out as we are aging. So this is basically spondylosis. It can happen in cervical region, it can happen in lumbar region. It usually doesn't happen in the dorsal region because of the dorsal spine, the movements are not much because of the rib cage all around. The dorsal spine is fixed. Most of the times we have movements in the lumbar spine, movement in the cervical spine, right? So because of the movement in the cervical spine, the cervical spondylosis is more commoner problem, right? It can result in pain, which is definitely a short-lived. It is not something, and in neck one may have to wear cervical collar also. How do we decide that whether the collar is really needed or not? I usually ask all my patients to grade their pain on a pain scale of 0 to 10, where 0, no pain, 10 maximum unbearable pain, where a patient will never think about approaching a doctor in clinic, and they will go to emergency without thinking, without having a second thought about it. So, if they are classifying their pain to 7 or 8, which is a severe kind of pain, then applying a cervical collar is good enough. Otherwise, it is not needed. Reason: using a cervical collar constantly will definitely weaken your muscles. The pain is because of the weakness in the muscles. The pain and the feeling is something like the neck will cut down and fall down. That kind of pain is there. So it is because of the muscles which have become weak, muscles which have become aching, and it needs only support till the pain becomes less than 5, less than 6. So if it is more than 7, 8, use cervical collar. If less than that, don't use cervical collar. Very simple guidelines, right?
Many of you might have received this picture in WhatsApp. Let's understand this picture little more in details. This picture is trying to depict that whenever you are bending forwards using your mobile, and mind it well, whenever we are using our mobile, we lose our attention on the position of our neck. We keep our neck bent forwards for a prolonged period of time and see how much weight passes through, and this is how the muscles become overworked, fatigued, and it makes it more prone to develop cervical spondylosis. So this is what is very, very important, that whenever we are using our mobile, we should be keeping it our eye level and we should not be bending it forwards.
Let me take this opportunity to discuss something very important in an entity called as dropped head syndrome, and this is a severe cervical thoracic kyphotic deformity as depicted in the image. A hump or over curvature of the thoracic spine has occurred. Presents with the neck and head pain and head down posture. You can imagine what can happen with excessive usage of mobile and odd positions. Severe decline in cervical range of motion. Physical examination shows normal muscle strength in neck and legs. Upper motor neuron signs when spinal cord myelopathy is present. Balance is often poor. Many of the different causes, but increases exponentially because of the computer and cell phone usage. This is what I was trying to highlight in this particular video, that excessive ergonomically bad postures while using your computers, while using your mobiles. If you are not bothered much about your positions, then these are the situations, worst situations which can happen, which we call it dropped head syndrome. Ultimately, it strangulates the spinal cord and obstructs the cerebrospinal fluid flow, leads to significant decline in quality of life, and symptoms can affect the whole body even. So this is what is very, very important for all of us to understand.
Next important thing is whether it needs any operative treatment. No, cervical spondylosis doesn't need any operative treatment. It is basically tearing of the facetal joints, and it doesn't need any. It can cause pain. It will settle down in due course of time. Nothing is needed more. What is more importantly is to do exercises once your pain is getting better by 60-70%. What kind of exercises are needed? Maybe we can share it in some other video next time. Yes, most importantly, pillow positioning. I have already published a couple of videos on right positioning of pillow placement. Pillow are really needed. It is a mandatory requirement to support your neck while sleeping. If you get pain, yes, it should be supported well. To prevent pain, it should be supported well. So if you are seeing a cervical spondylosis in your x-rays, definitely you should make use of the right position of your pillow, right? The next important question normally people ask is, I have already covered up my video on the lumbar spinal canal stenosis. One can watch that, because these are all the degenerative disorders which are interlinked, right? Cervical spondylosis is a different entity. When patients can also have pain in the neck, pain in their back together, and the only thing what they may be experiencing all this is because of their degenerative disorders, that is cervical spondylosis, lumbar spondylosis. Both things may coexist together as well. But a diffuse pain invariably is because the diffuse pain in the back from cervical region to lumbar region is more commonly because of the medical back pain. What are the medical back pain? What are the mechanical back pain? This I have already covered up in my previous videos. You can follow other videos in my same playlist of back pain. Spondylosis is basically caused by the normal wearing and tearing of the joints, while the spondylitis, spondylosis is a different term, spondylitis is a different term, right? Spondylitis is an autoimmune condition caused by problems in the immune system. Many people have ankylosing spondylitis, so it is basically how to differentiate these two. One distinction feature which I can tell you is when you are lying down, the pain increases. Lying down, the pain will be relieved in mechanical pain if it is spondylitis. But otherwise, with the spondylitis, the pain will increase. Any inflammatory disorder, any pain because of the tumor conditions in the spine, the pain will increase by lying down. So it's very common to get patients saying that by lying down, pain gets relieved. Okay. Now, what is the difference between spondylitis and spondylosis? The spondylosis is an age-related problem. Spondylitis can occur in younger age. Spondylosis occurs in the older age group people, right? 40 or 50 years plus will be more a commoner presentation for spondylosis. Spondylitis will be more in younger patients, right? Now one more term what we use in the spinal conditions is what is spondylolisthesis. Yeah. Spondylosis I have discussed already. Just to brief out a little bit more, it can affect any region. The spondylosis can affect any region of the spine, as I said, cervical region and lumbar region. It involves a defect. If it involves a defect in the pars intraarticularis, a piece of the bone attaching the facetal joint at the back of the spine, right? So this condition of the spinal degeneration occurring due to the natural effects of aging, right? As soon as we grow older, normal effects of the aging will be observed, and there can be some wearing and tearing effect. There can be some cellular changes and resulting in the structural changes in the spine, and that is very easily diagnosed by just doing x-rays, right? Many times patients do get MRIs on their own, but x-ray has its own importance. X-ray is not gone out of vogue. X-ray is very, very basic investigation required to be done. You must approach any orthopedic surgeon nearby to you to get the x-rays done, and the orthopedic surgeon can guide you properly that what is the importance and what is the significance of each of these terms in your particular case, right? Disc problem I have already discussed in other my video on lumbar disc and all. Lumbar disc and cervical disc, more or less the mechanisms are the same. The treatment, more or less the treatments are also the same. Diagnosing and treating lumbar spondylosis is again a lot depends. We may go for MRI if the pain doesn't goes off. MRI will definitely clinch the diagnosis, and if there is any nerve root getting impinged, it may need decompression, right? So, but majority of the patients will improve with conservative treatment of few weeks to few months. Surgery is mainly required only for the decompression part of that nerve root which is compressing, which we may come to know by clinical evaluation, the history, and definitely we can, by doing MRI also, we get an objective evidence what is going on there. Now, another important term is spondylolisthesis. Okay, so spondylolisthesis, when the spondylosis is left untreated, it may lead to spondylolisthesis. Spondylosis involves the separation of pars intraarticularis. Pars intraarticularis, very small, you can see in this diagram, pars intraarticularis, very small structure on the vertebrae. When one bone of the spine slips forwards, one vertebrae slips forwards over the lower vertebrae, that condition is called spondylolisthesis. And if it goes backwards, it is called retrolisthesis. So, these terms have to be understood. If there is a spondylolisthesis reported in your spine, the most important point to remember is never do spinal extension, because whenever you will be doing extension, then it will go more forwards. Grade 2, definitely you should not be doing any. Well, what are the gradings? Gradings are, if it is less than 25%, 25 to 50%, that's grade 2, 50% to 75% is grade 3. So, if it is 25% or more, that is grade 1 or grade 2, avoid doing any extension of the lumbar spine, as the spondylolisthesis is common entity in the lumbar spine. So, this is very important that to remember that we do ask to do spinal extension exercises if there is only disc problem to strengthen the back muscles. But if you have spondylolisthesis, make sure that you are not doing any of the back extension exercises. Spinal flexion exercises is a wonderful option that only needs to be done. right? So thank you very much. I think things are quite clear to you. What is spondylosis, what is spondylitis, what is spondylolisthesis, right? This is another addition to my playlist on back pain. These are basic terms to mention, and whenever a doctor is talking to you about these conditions, this is how it is to be interpreted. To summarize again, spondylosis is a degenerative disorder. Spondylitis is an inflammatory problem, more common. Spondylosis is more common in old age. Spondylitis is an inflammatory disorder, right? Spondylolisthesis, the defect in the pars interarticularis and the displacement over the below vertebra, and which can happen in some 10 to 15% of patients, and particularly in the degenerative age group, means elderly age group. What not to be done in spondylolisthesis patients is not to do extension exercises. Okay, no spinal extension exercises to be done by the patients who are having spondylolisthesis. Maybe grade 1 to grade 2 also, no need not to be done. But rest of the patients, if the spinal alignment is normal, if there is no listhesis, spinal extension exercises are definitely recommended, and that is the solution to spondylosis. Strengthening of the back muscles is the solution to spondylosis, the solution to all the degenerative problems. Similar thing I have stated in my knee joint pain also, knee joint osteoarthritis on the video also, that strengthening the muscles is the solution to address the degenerative problems, whether it is in the spine, whether it is in the knee joint, right? Muscles might be different, but the basic thing needs to be addressed is exercises to be done regularly. Thank you very much. Bye-bye. Take care. If this video was really helpful to you, make sure that you are subscribing this YouTube channel, Doc Talks. Make sure that you do share with your friends. Don't forget to hit the like button. Thank you very much. Bye-bye. See you. Take care. See you in the next video.